Next up on our roster, we have Dr. Michael Ambrose, founder of Camp Doc. And I've known Michael for quite some time, and he's really been instrumental in helping us kind of document in specifically our residential programs that are licensed, and how we collect medical data and what data we need to collect. And Dr. Michael Ambrose is also, well, he can tell you all about himself, but his background is vast and very specific with youth. And I think will be very instrumental in helping you make decisions about returning your minors to your campus. So without further ado, Dr. Michael Ambrose. I think you're still muted.
Hey, there we go. Hey, Pernisha. Hello, everybody. Thank you all for having me this morning. Excited to be chatting with you here for a little bit. I have a lot of content to get in the next 25 minutes. I will do my best. My goal is to, if nothing else, get you thinking about things and provide you with some resources so you can continue to do some of the additional legwork over these next few months. And so a little bit of background on myself. We'll jump right in here. So I am a board certified pediatrician. I have done all of my training at the University of Michigan, so undergrad, medical school, residency, and I still practice in a pediatric emergency room here in Ann Arbor. So I've been dealing with some of the COVID stuff right on the front line. Fortunately, there has not been a ton of craziness going on in the pediatric world, so it hasn't been terribly crazy in the pediatric ER. I have been involved in camp and camp health for, 15, 16 years now. Have worked quite a bit with Tim at the American Camp Association, Association for Camp Nursing, and then some of my colleagues at the University of Michigan. We have done a ton of camp-related research and have published studies and data relating to food allergies at camp, head injuries, eating disorders, vaccines, you name it. We've probably looked at it. Fairly recently, a little over a year ago now, I work pretty closely with the American Academy of Pediatrics as well. I was the lead author on their national policy statement, Improving Health and Safety at Camp. This is something, even though we're not going to talk about this document specifically, this is something that I would absolutely encourage all of you to take a look at. It is available for free online if you just search AAP Camp or AAP Improving Health and Safety at Camp. This is sort of the national guidelines, and we collaborated with ACA, with the American Camp Association and the Association of Camp Nursing on this document. But this puts kind of all of the best practices as it relates to health and safety in place. The reason I mention this document here is that in previous years, so this is a document that's released every 3 or 4 years. In previous years, this document was very specific to what we would all kind of think about as traditional residential or day camps. Lucky for all of you, this document has now been expanded with its recent release to encompass camps run on college and university campuses among other kind of non-traditional camp groups. So everything that is considered best practice for many camps is now incorporated in kind of a formal document and statement released by the AAP for all of the programs you're running as well. I worked pretty closely with the American Camp Association to create the COVID-19 field guide. I jumped on a little bit at the end, and it sounds like you guys have already been talking about that document, which is fantastic. I will make some reference to that as well. And then as Pernisha mentioned, I am the founder and CEO of Camp Doc and School Doc, which is an electronic health record software company for camps and schools. We have been working with UW-Madison for, 5, 6, 7 years now, quite a while. You all were an early adopter of our software, which is great. We have about 1,250 programs across the country, all 50 states internationally, and we do a ton in the higher ed space. So I will jump in, a lot of slides to get through, and then I know you guys are going to go to your breakout sessions, and we'll circle back for some Q&A. So in the next 20 minutes here, I'm going to try and jam pack in quite a few takeaways. So I wanted to start by talking about what did we learn from this past summer, dive into kind of how you can potentially use technology to help prevent outbreaks, and then most importantly, what are all the things you should be thinking about now, as we plan and think about this upcoming summer. So what do we learn from summer 2020? I don't have, at this point, as we're approaching a year of this pandemic, I don't have to tell any of you kind of the craziness that we all experience, right? 124,000 K through 12 schools closed, 55 million students at the end of last school year who were out of school, 82% of overnight camps that didn't operate. So it hit us all quite hard, certainly in the camp world, in addition to the whole community and the whole world. I'm going to try and give you bite-sized things because there's usually I could probably pack in about 90 minutes to give you all this information. So I'm going to try to give you, and I will share with Pernisha to share with all of you links to resources that you all can use. I wanted to touch on and just give you some high-level updates from this CDC report, and I don't know if this has been mentioned in your sessions yet this morning. This was a study that was done and published by the CDC. One of the authors on this research study was Laura Blaisdell, one of the physicians who was one of the 3 medical experts that I worked alongside with on the ACA field guide. And they talked a lot about and worked through kind of specific camps, 4 specific camps in the state of Maine. And I absolutely recognize that, right, this is looking at sort of the traditional camp setting. This is looking at overnight camps, and many of your programs things may be quite different. I imagine they are, but a lot of the lessons learned here are pretty applicable. I caught as I jumped on a few minutes ago. I caught Pernisha referencing talking about sort of accepting risk, right? We all know, and what I always talk about even before COVID, when I would give talks to higher ed institutions and camps about preparing for the summer, right? We all have to recognize that there is some risk associated with attending camp, whether or not you're in the middle of a pandemic or not. Pernisha mentioned a few outbreaks and the cases you've had and some of your campuses in the past. And so, right, the good thing that I think you all need to kind of give yourself pats on the back for is you've dealt with these sorts of things before. Maybe not a global pandemic, but we've dealt with SARS and MERS and flu in previous summers. A few summers ago, we dealt with measles, pretty widespread across the country. And so there's a lot that we can learn from these things. And right, I think everybody has to go in. Certainly, we all want to cross our fingers and hope that there will be no COVID if we are operational this summer, that there will not be any COVID, but we have to accept that there will be some risk, and there is certainly a potential of a case or an outbreak at our programs this summer. And so if you look at some of the results, and I'll share the link to this study, but you can pretty easily Google it. If you just Google CDC camp study, it'll be the first one that pops up. But right, what we did learn, and I'm going to talk a little bit about NPIs, non-pharmaceutical interventions. There were cases of COVID at these camps that operated, but they followed these best practices and guidelines so well that they minimized the spread. They were able to isolate easily, that they did not have to necessarily shut their camps down. Right, that's worst case scenario. Is that right? We're not well prepared, and without a doubt, sometimes things are out of our hands, and we may have to. But putting the best practices in place will reduce your risk as much as possible. So it is important to know that there is not one single strategy that's going to be 100% effective, but the more strategies, the more processes, prevention strategies we can put in place, the better prepared we're going to be. Again, we're approaching a year of this pandemic. There's probably nothing on this slide that is surprising to you, right? And I'll quickly go through each of these. But when we looked at the CDC study, and there's some other research, we haven't published it yet. I've been working pretty closely with the Association of Camp Nursing. We've looked at data of camps that have run, and the camps that followed the bullet points on this list were the ones without a doubt that were most successful. And the thing that I want to get across so much right now, I'm always somebody that tries to see the glass half full, right? The craziness of last summer of 2020 is that it was all happening. We were learning so much, things were changing day to day. Weeks or only a month or so before camp begins. The nice part, if I have to put a positive spin on this, is that we've got 5, 6, 7 months before the summer begins, and so there is a lot of time and a lot of planning and preparation that we can do now. And how you communicate that to your families and how you prepare now is going to set you up for success should you operate this summer. So pre-arrival quarantine, this is something that we're all certainly familiar with. There's without a doubt a lot of COVID fatigue right now, and and certainly in certain regions of the country or certain cities, people aren't quarantining as much as they should. But your families want to get their kids to camp. Your campers, your students want to come to camp. And if you lay out the foundation and you set this as a requirement, and you notify your families in advance, the camps that did this saw better success rates. Pre-arrival testing, I heard Pranisha mention that already, that is a system-wide requirement. The camps, and some of this will depend on the length of your program. If you are running just a 4 or 5 day program or a weekend event, post-arrival testing may not be quite as important. For those of you that might be running longer programs where kids are there, our students are there for 2 weeks, 3 weeks, perhaps longer. Camps that did post-arrival testing, so about 2 to 3 days after they arrived, and had that in place, were able to weed out students or campers that were missed. Symptom screening, we'll talk a little bit about that in the next little bit. Cohorting, and this is quite important, right? Creating your bubbles or your cohorts, and then a lot of the things that we are very familiar with: face coverings, physical distancing, enhanced hygiene measures, lots of cleaning and disinfecting. And then the big thing that was, I think we all thought was going to work, but proved, and we're really just diving into the data now. So subjectively, or at least on its surface, but we're pretty confident as we take a deeper dive into the data. Ventilation is beyond important. And so the more programming, the more things that you can do outdoors, the better. In many instances, on first glance, the camps that ran and did everything outdoors, they even moved their nursing practices or any first aid, medication administration. Everything was moved outdoors, and some of these were even more less camps that were maybe not a traditional camp out in the woods. They set up a big covered tent, and they did their STEM computer programming classes or coursework outdoors. And so the more that you can do outdoors, meals, activities, most of those camps had no cases of COVID. And so that was something that we felt pretty confident this past spring was going to be important, but it was really solidified as we looked more. How can I use technology to help prevent outbreaks? I'm going to show you a few slides from CampDoc that we've used for a while now with UW-Madison. And so coming up with your plans and practices, whether or not you're using CampDoc or another tool, figuring this stuff out now is going to be super important. We talk about the concept of pre-screening. This is asking a series or a set of questions prior to a student's arrival, prior to your staff's arrival at your program. And so this is, many of you are maybe doing this already if you're, for places you are currently going. The current recommendation, camps have been doing this, and some of this, there may be Department of Health rules or recommendations for your particular counties or cities, but doing this somewhere between 7 to 14 days prior, every single day, telling your parents that you need to take the student's temperature every day and report on this, and so that we can weed out and make sure anybody who is testing or positive or flagging positive on this pre-screening, we're coming up with an alternative plan. Maybe they're not coming the first week. We're deferring their registration to the following week. The second is screening. And so many of you are, my hope is many of you, when your students arrive on campus, are doing some sort of screening, right? This is your lice checks, checking in the medications when your students arrive, making sure nobody has fevers. Many camps, most camps were, or at least should be doing this even before the pandemic. There should be there should be adopted even more in the current environment, where in many instances most camps are taking temperatures, right? Many schools, we're learning a lot from the K through 12 schools that are doing in-person learning now, right? Taking temps right every day upon arrival and answering an additional set of questions. And so within this tool, within the CampDoc tool, you can do that as well. And then, right, using these tools not just for the sake of collecting the data, but actually reviewing the data and coming up with a process to analyze and make decisions in a decision tree based on the data that you're collecting. One of the things that I absolutely want to point out with this, and there's been a lot of talk, it's not becoming terribly public yet, which is probably a good thing. My hope is that everybody is doing this right across the country, but collecting this pre-screening data and screening data is considered PHI or HIPAA protected information. So just doing your pre-screenings on a Google form or a spreadsheet or a scratch sheet of paper is really a big no-no. And so making sure whatever tools you are using on your campus or whatever you're using for your program meet whatever security privacy requirements are in place. Okay, I'm going to jump in. I got about, I think, 10 minutes left here and kind of talk a little bit about some of the meat of the stuff, what you should be thinking about now, right? We are in the middle of January, and we've got lots of time to be thinking and preparing. And so I'm borrowing a few slides for some of my longer talks, and I'm going to focus on the first two bullet points here. When we think about pre-camp, right before camp is starting, we talk, and I'm going to very briefly touch on all the bullet points, and then I'm going to dive into the CDP and supplies and PPE. So let me skip over that and talk a little bit about local resources. And so when we talk about planning, one of the really important things that you should be thinking about now, in addition to your CDP and supplies and PPE, are communicating with your local resources. So this means, right, those at your university that, at your institution that, you may need to get approval from in order to run particular programs. This may mean, right, following up to make sure you know where to send kids and how to isolate them. Is there anything you're using University Health Services for? In what instance, or what facilities or what locations can you send somebody for testing? Is that testing a rapid test? Is the testing at that facility or that location? How long before you're going to get that PCR test back? The bullet point communication, super important. My phrase that I've been using over this last year: this is the time for you all to over communicate. Families, everybody knows and expects that things are going to change, and the recommendations or policies or information that you communicate to your families now very well may change by the time May, June, July hits, but that's okay. They want to hear something from you. And one of the things that we learned very early on is communication about refund policies, right? Policies if your camper if a student is exposed to COVID while they're at your program, are they going to have to be sent home? Are you going to isolate them at your program? If somebody, you want to set something up in place so that your families are very honest with you and providing you with information, accurate information and timely information. So if you make your refund policies very clear, you're more likely to get better results in your pre-screening. Right, and so a camper screens positive for a fever 5 days before your program. What's your refund policy? Are they going to be refunded? Are you going to let them defer to come to a program the following week or 2 weeks later after they've done their 10-day quarantine? And communicating that all now, really, really important. Communicating your screening process now. Even if you don't know if you're going to have them pre-screened for 10 days or 14 days or a week, letting them know that there will be some sort of pre-screening process and some sort of screening process upon arrival, especially if you're running any programs for some of your younger campers, right? By now, I imagine most kids are probably used to having their foreheads zapped with an infrared thermometer, but some may not. This may be their first experience out into the community, and if that's the case, letting them know to reduce any sort of anxiety. Health history, collecting the information in advance, super, super important. I overheard a little bit you all talking about vaccines and immunizations. I don't think anybody expects that the COVID Pfizer or Moderna vaccines will be available for kids by the time this summer starts, but they very well could be available for your staff, and capturing that data in your health history, really, really important. So let's talk a little bit about a CDP. A CDP, this is a new, shouldn't have been a buzzword, but is now a buzzword in the camp community because of COVID. This is something that we all in the camp medical community have been recommending for years and years now. Right? This is the same thing we would recommend that you have every summer for something like measles or influenza or even a stomach virus. What are you going to do, and who needs to be involved to plan? And so your CDP looks at a few different things. It looks at prevention. How can you prevent the spread of illnesses or outbreaks before camp? How can you prevent the spread of illness during camp? What are your interventions? What are you going to do when an outbreak occurs? And then it talks and thinks through your recovery and mitigation strategies to lead you to resolution. And so the question that I get all the time is, hey, Michael, can you just give me a CDP that I can use at my program? And I wish I could, but the short answer is nope, I cannot. Every one of your programs is completely different. Some of you run commuter day programs. Some of you run overnight programs. Some of you run athletic programs where social distancing may be a little more difficult. Others may run STEM programs, right, where there's more. It's easier to socially distance. The resources at each of your programs, the number of staff may differ, and so I will share this. If you're not able to copy it down, I will share this with Pernisha to disseminate to all of you. If nobody has mentioned or referenced the Association of Camp Nursing yet, this is a fantastic group. I don't get any sort of commission or anything for recommending them. I have worked very closely with them for years, and they have lots and lots of free resources. You do not have to be a medical person. You do not have to be a camp nurse to use their resources or to join, but they have a fantastic CDP template, and that is without a doubt your best starting point. And so that will give you and go through a series of questions that you should answer. And this is something you all should start working on this month. If you are planning to run your camps, creating your CDP, figuring out who your key personnel are, figuring out how you're going to isolate someone, what are you going to do in the event that you have an exposure, all of that is covered in your CDP. And your CDPs are all going to look very different depending on access to specific facilities, right? depending on the population you're serving. I don't, I don't think we quite know yet. I know some of you and many of you may be working with international populations. That may not be a thing this summer, but if it is, right, that may be a different policy for sending kids home. You have a kid coming in from overseas and they test positive for COVID. You can't just send them back to their home country. You'll have to isolate them here. And so, right, thinking through all of that is the most important thing from a medical standpoint that you can be working on now. In many state and counties, a CDP is required now because of COVID in order for you to operate. And so that's something I would encourage you to be checking with your local Department of Health as well. In many instances, some of the better well-prepared departments of health are asking for it in advance, or in the event that you needed to call on them because you had an outbreak, they may ask to see your CDP, and you don't want to be caught with your pants down, and so you want to make sure you've got your CDP ready. The next thing I will talk about are supplies. This is something that many of you have probably thought about, but probably haven't acted on quite yet. And this is something you should absolutely be thinking about as well. In the ACA field guide that I know Tim was mentioning and that I've linked to, there is a section on the ACA field guide that specifically references what types of supplies you should have and how many. And that is all accessible for free. I copied and pasted some of the recommendations here, but these are things you probably haven't had to think about in previous years, and unfortunately things you probably haven't had to budget for in previous years. And so thinking through and making sure you are purchasing these well in advance if you are intending to is important. Knock on wood, the supply chain here in the country has gotten better, but it is not great, and things are changing pretty rapidly. So before, this past summer, nobody could get N95s or disposable face masks or gloves. Just recently, those things have become more readily available. Right now, there is still a pretty large shortage on gloves and disinfecting wipes. Those things are still a little bit harder to find. 3-ply face masks are pretty easy. Infrared thermometers are pretty easy. Right, as you develop your CDP, it's going to help inform and guide you on sort of what things you may need. Right, if you're going to be doing check-in and scanning temperatures every single day, and you have a large volume of students at your program, 2 infrared thermometers may not be enough. You may need 5, and you may need to have 5 of your staff checking temperatures. And so, right, as you think through your check-in process, all of that's going to be really important. Pernisha, cut me off if I know I'm going a minute or two over. I only have like 2 slides left.
Keep going. We're almost done.
Okay, cool. The other thing I will reference is part of CampDoc. One of the things that we have done for a long time now, in addition to our electronic health record software, we also we are a medical supply company, and we did this specifically for camps. In many instances, you can find lots of these things, but we had always heard that camp directors were taking multiple trips. They'd go to Costco for these 3 things and Walmart for these 3 things and order these 4 things on Amazon. And we wanted to become a one-stop where we could also get discounted pricing for camps without having to buy in bulk. So this is something we've done for a while now. Certainly in the times of COVID, we have expanded into even more PPE. And so if you go to supplies.campdoc.com, and we have recommended items there based on the ACA field guide without having to buy in bulk. I will absolutely admit that some of our pricing is a little bit higher, maybe a 5% higher than what you probably could find on Amazon. But for most of these things, we have immediate availability. And so we have worked with multiple sources in order to get these in the hands of camps. The other thing that I will mention, because I'm pretty excited about it, I've been a very big advocate for food allergies and having camps get access to EpiPens or injectable epinephrine for their programs. And Pranisha, I don't know if UW System has any sort of policy or recommendations on this, but it is a recommendation in the AAP field guide that camps have stock epinephrine. And so we were now able just to secure the AviQ. So we do have the generic EpiPen available that you can get for your camps. And just a few weeks ago, we were able to get AviQ. For those of you that aren't familiar, it's about the size of a credit card, and it's almost like an AED where it actually talks to you and tells you exactly what it's electronic and tells you exactly what to do in the event that somebody is having an anaphylactic reaction. And well, everybody and all we're talking about is COVID. All the normal things that happen every summer are things you got to still plan for and prepare for as well. The other thing that I will mention here, I don't know how relevant this will be for some of your programs, but if you are planning to do testing at your camp, so certainly the recommendation, sounds like the recommendation from UW System is that people must test prior to their arrival. There are lots of camps that are planning to do testing on site. In the event, right, everybody, again, this is going to be a normal summer, so all of your students are going to have coughs and runny noses and little rashes here or there, the same things they have every summer, but everybody's suspicion is going to be real high for COVID. So every time somebody comes in with a runny nose or camp crud, that I like to call it, everybody's going to be worried about COVID. And so many camps are planning to invest with some rapid kind of what we would consider at-home testing. These are the two tests that the Association of Camp Nursing and sort of the general camp health community are recommending. They're not real easy to find right now, but production is being ramped up quite a bit, and the hope is by this spring these will be more readily available. The Lucero one is actually a PCR test that can be done at home, a rapid PCR, which is pretty cool. And the Illumi, I think I'm saying that correctly, is an antigen test. So I don't have any affiliation with either of these companies, but I wanted to share that if you intend to make testing at your program part of your CDP. My last slide here, this is a slide I use in some of my other talks too, prevention at camp, thinking through your drop-off and pickup procedures. This is something that's looking much different, and many camps loved this so much they're planning to not go back to the old way, but just doing drop-off and pickup in the car. This certainly for day programs, right? Not getting out and families getting out, lots of goodbyes, but right, kind of like they're doing at my child's daycare right now. They're zapping, taking the temperature while the kid is still in the car, asking the questions while everybody's still in the car, and the camper gets out. We talked about health screening already, training for your staff. We saw a lot of cool programs that ran this past summer that tied sort of your performance evaluation for your staff members to kind of hand hygiene and best practices. So, right, well, you may be evaluating your staff at the end of each session or each week on particular things related to activities that they're running or conflict resolution, right? Putting a section on sort of your checklist of things you're reviewing them on related to sort of best practices, because they have to be the ones modeling good behavior. Reviewing your illness data daily, right? Not just collecting temperatures that we talked about, but actually doing something with this data. And then all of your best practices for those NPIs, the non-pharmaceutical interventions. Okay, I went over. I'm sorry, everybody. This is my email and phone number. I know we're going to circle back, I think, after your breakout session. Whether or not you're a CampDoc customer doesn't matter. I am always happy to help. You can reach out to me with more specific questions, or you want to bounce an idea off me, give me a call, shoot me an email. I'm always here to help. Okay.
Thank you so much, Michael. And so before we hop into our breakout groups, I wanted to bring up a couple of things. Number one, when you're talking about your university health services and who your resources are on campus, keep in mind that most university health services are paid for through segregated fees, which means that you might have to work with your campus to contract out or other contractors to contract out to cover the cost of assisting you during this time. Also, it goes back to my original statement about crowdsourcing resources. Residential camps that are under the DACCAP license were already required to have some of these protocols in place. And so they might have a person already doing these things. So what I would encourage some of you commuter programs that are running at the same time is what programs on your campus can you partner with to maybe share their medical staff, right? So that you can actually get the help and assistance that you need. So for the breakout sessions, we're going to have you basically discuss what medical parameters have you started thinking about and putting in place. Also, know that for the testing, like I said, we've set aside 40,000 tests specifically for minors coming to campus, and they're working on that now for the spring and summer. And so I think the testing is there, but also keeping a list based on the number of participants that you have. What is it going to cost you for PPE? What is it going to cost you to provide medical services to your youth? And what is it going to cost you to have an isolation plan? Because that also means additional staffing, not just supplies. So I would consider all those things as you break out into your group and talk about what medical thoughts you've had and what plans you've already put into place. And so Tom will break you out into groups now, and we will break out for 12 minutes, and then we'll come back and share. Hello, and welcome back. So we are going to take the next 15 minutes before lunch, and we are going to, one, share out what you all talked about in your group, and then two, any questions that you might have for Dr. Ambrose. So we can do like one at a time. If you just want to unmute yourself and kind of share what you talked about in your group, that would be great. And then maybe a question that may have come out of your group for the doctor. So feel free to just go.
Don't be shy, all. Somebody's got to have some questions.
I can go. My name's Natalia Ornelas. I'm with UWM, UW Milwaukee specifically, with TRIO and pre-college programs. So out of our group, I think that all the medical questions and guidelines made me specifically nervous, and thinking about our summer programs and thinking of will we ever be prepared to really bring back students on campus? You know, I think prior to this, a lot of us were thinking, yeah, our students need to be back on campus. We need to be back on campus. We're better in person. But honestly, I really wasn't thinking about this part of it, you know, as far as all the precautions we need to take. So I appreciate all the information you shared with us today. And I know our group was thinking about that too. Are we ready? How can we even be ready at this point?
Yeah, Pradesh and I were just talking about that a little bit while you were in your breakout sessions. I'm always fearful when I first give some of these presentations that everybody's going to leave in a panic, and that is absolutely not the intention. My goal is to get you thinking. And so, yes, the short answer is you can do this safely. It may not be easy, but we saw for the 20% of camps that did open, they did it, and they did it well. And your families and your students need this and want this more than ever. And they understand, and with your good communication, they will understand the risks and what you're doing to keep the students as healthy and safe as possible. I packed a lot of information in 25 minutes. Your next best step is to start on that CDP. Get that template from the Association of Camp Nursing. And as you start to put a plan in place, this isn't just, this is with really anything that you're doing. When you're starting a project, it always feels a little more overwhelming in the beginning. But as you start crossing off some of the boxes, let me think about who my key players are as I craft this plan. Who are my key staff members? Let me start thinking about supplies. But it's only the middle of January, and you have, or hopefully have, plenty of time before your programs start. And if you start checking the boxes on that CDP, the way the ACN's template is designed is great. And it sounds like, Pranisha, that they have access to some of these guidelines and templates already through UW system. And
check out our website. Yeah, check out the website for today's event. The first thing I would recommend is you read the field guide, because even I thought this would be impossible until I read the ACA field guide. And it really put into perspective that 60% of the stuff we were already doing, we just had to put more intentionality behind it. The other thing is that these are just kind of an introduction workshops around how we need to plan. We're going to bring Dr. Ambrose back and have a 2-hour workshop focused on just medical planning. So we just wanted to get you all thinking about all that you needed in place to actually start doing this work. And so if you read the field guide first, and then your pre-college liaisons should be convening work groups with your risk management, your HR, your student services. They should be convening this work group. And within that work group, they can work with your campus to create a plan for all of your programs so there's more quality assurance behind it. But what I would say is work with your pre-college liaisons to see what resources you will have available to you on your particular campus. And then also note that we will continue to do the professional development to support you in your planning. So this is just an introduction. What I will say is most of your residential programs, if they were under the state license, already had a communicable disease plan because it was required for that. And so once again, it's crowdsourcing. Hey, can we duplicate your plan? Can we borrow your plan? And if not, also the manual that we're creating at the system level will have templates for emergency plans, safety plans, and that includes quarantine protocols, isolation protocols, notifying parents about communicable diseases, so communication plans and all that kind of stuff. So we're working tirelessly on this end to make sure that you have those resources in every program.
And the other thing I'll add to that is the question that I would get early on in the days of the pandemic is, oh, well, why do all this stuff when the pandemic is over with, or when we don't have to think about COVID anymore? This isn't going away, and so whether or not you're running programs in June of this year, or you're going to wait and not run programs until October of this year, right? Creating these CDPs, thinking through this, unfortunately, some of these things are probably here to stay. And so working on some of this now is not necessarily a fruitless effort in the event that you don't run your programs, right? You got to get started on it at some point because the stuff that you put into place this summer and hopefully you run and operate will be applicable for summer 2022, which is crazy. We're talking that far out already, but great question.
Thank you. Any other questions or observations from the groups that people would like to share? It's a safe space. Karen Stroud-Felton, do you want to share? I can just start calling names that I know share.
Actually, we just had a question come in on the chat. Can you speak to how some of the variants may impact upcoming months?
Yeah, good question. This is, I'm getting a little bit of echo. This is all still very new. We are, we don't know a ton just yet from what we do know, right? That this variant is potentially more contagious, but less, it causes fewer symptoms or is less severe. I think one of the things that perhaps the media is not necessarily focusing on. I don't think, and I think the general medical community doesn't believe that the variant just arrived here in the US in the last week or two. It's probably been here for a while, but now that we're aware of it from Europe, we are now testing and looking at that a little bit more. And so I don't know if we necessarily, I don't think there's consensus yet in the medical community of what we expect to happen next, but it is very likely that that variant has already been here. The encouraging thing is that the vaccine is showing protection against the new variants, which is a great thing. And while you all were in your breakout sessions, Pranisha and I were talking a little bit as well. Most states, and I know sometimes it is dependent on the county or the city too, there's a lot of advocacy work, and I'm involved in a little bit of it to advocate for camp staff, youth staff to get moved up higher in the vaccine priority list. So to be put in sort of the same category as K through 12 teachers. And that's something you all should be thinking about now too, in terms of if the vaccine is readily available, sort of what wording, and I don't know if UW system has something from a higher level, but right, is there going to be words about strongly encouraging your staff members to get the vaccine if it is available? But I think that is, there's a lot more that we'll learn about the new variants in the coming months, but I don't anticipate it having a huge impact on this summer.
And I can piggyback on that you all will hear from DACAP, Stephanie from DACAP later on today. And they've been one of the entities that have been advocating at the legislator level for camps and programming staff to be part of the educator tier, because you all will see these youth before they actually physically get into their school, and you will see these students in masses. And so it's one of the groups that's actually advocating for camps be considered in that tier. So Stephanie may speak to that a little later today, but you all are not forgotten at the legislator level. And it's helpful to have people, like for me, for instance, I'm actually on the board with DACAP and making these recommendations. So the voice of UW system is always present when these decisions are being made and elevated. So any other questions or observations? We want to make sure we get you to lunch right at noon, but we have about 4 minutes.
I saw a question from Carrie come in the chat. Are the AAP best practice guidelines in terms of children or in terms of children and their families? That's a really good question. It's a fairly long document, but if you read through it, you'll see that it really encompasses the entire camp experience. So it talks about recommendations for the camp itself and the camp directors. It talks about recommendations for the families. It talks about recommendations for the children, for the medical staff at your programs, and so really is all encompassing. It references family camps. I don't know if any of you run family camps where you don't just have children there, but you have the entire family there. One of the things that I would point you to on the Association of Camp Nursing site as well. This is something they've had on there for a while, but I think it's even more applicable now than ever. They have a document or a blog post called Healthy Camp Starts at Home. Did this get I see you nodding, Pernisha. Did somebody reference this already?
No. I've just read that several times, and it's very true. Healthy campers start at home. Yeah.
Yeah. So something I point to all the time, and I'd encourage you all to take a look at that too. Right. It really talks about that. You really need buy-in from your families, and you need if you're running an athletic or a rec program, and you expect there's a lot of physical activity at your program, right? The expectations for the families have to be crystal clear that the camper needs to come well rested and well nourished prior to their arrival. Right? If the expectation this summer is quarantining for 2 weeks prior to arrival at camp, because if you don't, you may miss out on an awesome opportunity. Right? It really talks about that as well, and so that's another resource. That document is great. And many of us in the camp community have relied on that document as well. Great question.
Thank you. Anyone else? You're welcome to type it in the chat. Can you speak to how? Oh no, we already did that one. Any other questions? Would anyone like to unmute or type in their question?
Pernisha, could you go back one more question? Like budgets continuing to be cut, and how do we manage staff and resources as we talk about this? Because we're kind of fighting two ends of that one at once.
Absolutely. So I'm going to go back to crowdsourcing. So when you overhire staff, what I would say is overhire and train camp staff for your camp season and make it so they can work in any camp during this time versus every single camp, which you may have 47 camps running on your campus, every single or all 47 staff or all 47 camps having to overhire. So I would create a staff pool, number one. Number two, as far as budgets go, having the conversations with your campus leadership and seeing, what is some of the PPE, what is some of the stuff that's already left there to make sure that you all are part of the conversation to get those resources. And then if you all are receiving grants or you're receiving, funds from the states or other donors, help them understand that there is a cost of safety and a cost of compliance that's more expensive now than years past. And so you have to include that cost in your grant proposal. And I know that I have spoken directly to DPI, Alicia over at DPI about this. I said, we've had the standard amount of what we would give programs, pre-college programs every year under DPI per participant, and that needs to substantially change now because the actual cost is more substantial per participant. And so I know that in the last 3 months, they've been working on that and trying to see what the modified costs or the modified grants could be for these pre-college programs. So anywhere you get funding from, we'll understand that there are additional costs to do this with minors. And to note that if we don't have support from our institutions, then we can't do the work. And so there has to come a decision. Like, okay, we can't afford to do it safely. We can't afford to do it the way we need to. Do we hold off on doing it in person another year? Do we hold off on even doing it at all because we can't afford to do it safely? And honestly, if we can't afford to do this work safely, we can't afford to do it at all. But crowdsource, share your resources.